I'll be your nurse practitioner today. I have down that you need a physical exam. Have you ever had one of those before?
Yeah.
Okay, so I'm just going to be checking out your entire body from head to toe. I saw that the medical assistant already took your vital signs and those all look great. Your height and weight also look totally normal for your age. Do you have any questions or anything before we get started? Okay, while I'm doing the assessment, if something is hurting you or bothering you or if something comes up, just let me know. Okay? Alright, so I'm going to go ahead and wash my hands. And so I'm just going to start with looking at your general appearance. You're well kept, you're dressed appropriately for the weather, your hair distribution is normal, the texture of your hair is good, your skin coloring is good, the elasticity of your skin is normal, you look well hydrated, your nail beds look good, nice and pink, capillary refill about 2 to 3 seconds, that's perfect, and it looks great, and your nutrition status looks great. Okay, so now I'm going to be moving down. I'm going to be looking at your ears and going to be palpating your neck for any masses or abnormal pulsations or lymph nodes. Any tenderness there? Okay, go ahead and clench your jaws. Good. Okay, and if you can go ahead and smile for me. I'm going to be testing your cranial nerves, puff your cheeks, and I'm going to test your hypoglossal nerve, then stick out your tongue and go from side to side. Good. Okay, so now I'm going to get my light, and I'm going to go ahead and check out the inside of your ears, looking at your tympanic membrane. Okay, that looks good. The tympanic membranes are nice pearly white. Okay, great. And I'm going to go ahead and look up your nose. And go ahead and open up your mouth again, stick out your tongue and say ah. Okay, great. I'm going to go ahead and test your gag reflex right now. Okay, good. Sorry about that. Okay, and you know, one thing I forgot, I'm just going to palpate your scalp looking for any masses, lesions, lumps, bumps, any tenderness or anything there?
No. Okay, good.
Alright, next thing I'm going to do is test optic nerve number 2, and that's your visual acuity. So I'm going to stand about 6 feet away, and I'm going to have you cover up one eye and go ahead and read down the line as far as you can go.
ELTFPHOLCFDHJALTFPH.
Perfect, and go ahead and go on the other side. If you want to just read the last 2 bottom lines for me.
CFDHJLTFPH.
Okay, and you want to go ahead and do both eyes?
CFDHJLTFPH.
Okay, perfect. Now I'm going to be looking at cranial nerves 3, 4, and 6. I'm going to test your 6 directions of gaze, also look at your pupillary response to light and the accommodation. So go ahead and follow my pointer. Okay, now I'm going to be shining this light in your eye. Just go ahead and look forward. Perfect. Great. Okay, so next I'm going to be testing your hearing, and that's cranial nerve number 8, auditory nerve. So this is called a tuning fork. The first test I'm going to do is called the Weber test. I'm going to strike this on my hand, and I'm going to put it on your scalp, and you tell me if you can hear it more in the left or right ear or right in the middle.
In the middle.
Okay, perfect. That's totally normal. And then the next test is the Rhine test, and that's going to be measuring air to bone conduction. So first I'm going to strike it and put it on the back of your ear, and you're going to tell me when you stop hearing the noise. And then I'm going to put it right in front of your ear, and then you tell me when you stop hearing the noise.
Okay. Okay.
Perfect. So in normal air and bone conduction, the air conduction should be about twice as long. So I'm going to do this side. And then I'm also going to be, I'm gonna whisper into your ear, to test your hearing, and you just repeat the word that I say.
Purple. Yellow.
Perfect. The next thing that we're gonna do with the tuning fork is I'm gonna be striking it and measuring your sensation in your hands and your feet. Just tell me if you can feel it.
Yes. Yes.
Okay, and then on each of your toes.
Yes. Yes. Perfect.
Okay. Okay, now I'm going to be testing your reflexes. So the first one's going to be your brachioradialis right here. Perfect. Okay, and then go ahead and lift up your arm, and this is your tricep. Great. We'll go ahead and do this side. So brachioradialis, and your bicep, and then tricep. Perfect. And then patellar. Good, and then behind your knee. Good. Achilles. And then go ahead and raise your foot up, and we're gonna test your plantar reflex. Great. And then we'll go ahead and do it on this side. Back of your knee, and then Achilles, and then plantar. Great. Okay, so now I'm gonna be doing some more tests of your sensation. One that we're gonna do on your face is gonna test your trigeminal nerve, number 5. So I'm gonna run this across your face, and you tell me if it's sharp or dull. Go ahead and close your eyes.
Sharp. Dull. Sharp. Dull.
Perfect. Okay, keep your eyes closed, and I'm gonna do it on your arms and legs.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Perfect. Alright, now I'm going to be testing cranial nerve number 11, so go ahead and shrug your shoulders. Alright, and I'm going to test the resistance. Go ahead and put pressure against my hand. Good. That was good. Okay. And so now I'm going to have you go ahead and stand up. We're going to do your musculoskeletal and neuro exam. So go ahead and move your neck. That all feels normal. I'm also going to be palpating for any tenderness. Go ahead and move your shoulders. Okay. And your arms. And go ahead and push against my arm. Good. Nice and strong. Alright, let's do both sides. Okay, good. Let's go ahead and squeeze my hands. Good. And go ahead and move range of motion. Any tenderness there, anything. Okay, go ahead and try to move your hip joints. Any tenderness there? Any pain? Go ahead and do a shallow knee bend for me. Good. And any knee pain there while I'm palpating? Go ahead and do range of motion. Okay. Go ahead and take a seat again. I'm going to test the strength in your feet and your legs. Go ahead and push against my hands and with your feet. Good. Do this side. Great. Nice and strong. Okay. Perfect. Okay. Go ahead and stand up again. We're going to do some walking. So the first walk I want you to do is just a normal walk. Okay, and then on our way back, we're going to do walking on our heels. And then walking on our tippy toes. And then on our way back, we're going to do heel to toe walking. Good. Okay, and now we're going to do what's called the heel to shin test. So we're going to get one foot or heel up and then push all the way up. Good. Let's do the other side. Okay, now I'm going to have you close your eyes, put your hands out, and alternate, put your hand on your finger on your nose. Yeah. Perfect. Okay, go ahead and keep your eyes closed. I'm just going to give you a tap and just test your balance. Okay, great. All right. Let's have you bend over. I'm going to look for the alignment of your spine. Just looking to make sure there's no abnormal curvatures or any pain or anything there. Having any tenderness when I'm touching? No. Okay, good. Okay, you want to go ahead and take a seat again. And now I'm going to be listening to your chest, your lungs, and your belly. So first I'm going to be listening to your lungs in the front. So I'm just going to have you take a bunch of deep breaths as I listen. Okay, good. So go ahead and listen to your back. And on the sides. Okay, great. Now I'm going to be listening to your heart sounds. So first we have the aortic, pulmonic, Erb's point, tricuspid, and bicuspid. And I'm looking for the PMI, which is the point where I hear the heartbeat the loudest, and for her it's the apex, which is normal. I'm also going to be listening for bruits with the bell, aortic, pulmonic, Erb's point, tricuspid, and bicuspid. And that all sounds great. Okay, the next thing we're going to be testing is for tactile fremitus. So I'm going to be putting my hands on your chest and back, and I'm just going to have you say the words 99.
Okay. 99, 99, 99, 99, 99.
Okay, perfect. Go ahead and turn around and again.
99, 99, 99, 99.
Perfect. Okay, so now I'm going to have you turn back around again, and we're going to be looking for respiratory and diaphragmatic excursion. So I'm going to be percussing the back, looking for the point where the lung ends, and we're looking for the diaphragm, and just listening for nice resonant sounds, which means that there's air in the lungs. Okay, now I'm going to have you take a deep breath and hold it. And I'm looking for the new base of the diaphragm as her lungs have expanded. Okay, and it looks like it's right about here, which is normal. Go ahead and breathe normally. And next time you feel comfortable, take a nice big deep breath. Good. And as I'm inspecting her inspiration, it is, you can go ahead and breathe normally. It is equal and symmetrical, and that all looks normal. So you can go ahead and take a seat. And I'm actually going to have you lay down, and I'm going to go ahead and listen to your belly. First, I'm going to inspect it. There's no obvious lesions, rashes, or anything like that. So now I'm going to go ahead and listen to all 4 quadrants of her bowels. Okay, now I'm going to be using the bell side to listen for bruits, the aortic, renals, iliac, and femoral. Okay, and that all sounds good. And now I'm going to be doing palpation. While I'm feeling your belly, if anything hurts, just let me know. Okay, that all looks great. You can go ahead and sit up. Okay, one neuro test that I forgot to do with you is rapid movements of your hands. If you can go ahead and go like that. Perfect. Okay. All right, and so that concludes our physical exam. Do you have any questions or anything?
Nope, that's it.
Okay, thank you. It was nice meeting you.
Thank you.